So the discussion that we're going to be having today is regarding military communication versus EMS on the civilian side, and some of the ways that we may see integration between the two groups. So if you want to go ahead and introduce yourself.
My name is Seymour, and I am studying to become an EMT, not currently one yet, but yeah.
I'm Grayson Engels, and I am a firefighter EMT.
I'm Jordan Derowitsch, and I'm in the EMT course, and our guest speaker here that we have is Will Rudy, and he can kind of give you guys a rundown of his military background.
I've served as a medic as a corpsman in the Coast Guard, a corpsman in the Navy, served with the Marine Corps as a combat corpsman, and I'm currently in the National Guard as a medic. I am also a nationally registered EMT.
All right, so he and myself actually work together in the National Guard, so we're going to kind of give some of the counterpoint to some questions from Anna and Grayson here.
So first off, I was wondering, what is the difference between, like, in dispatch information between civilian and the 9-line medevac? What are the differences?
Okay. So, if the main point on this is if you're operating in an area, or if your district includes military training sites, the 9-line medevac, like she said, is something that you may hear come over the radio. It's the military's way of conveying injuries and severity of injuries in a rapid fashion over the radio. So you'll hear somebody listing off line 1, 2, 3, 4, and the main ones for the EMS side is if you hear lines 3, 4, and 5. Line 3 is the severity of your patient. Line 4 is going to be any special equipment needed, and line 5 is going to be if the patient is litter or ambulatory. So if you guys are working in an environment like that, it may be beneficial to, or if we as EMTs, it may be beneficial to get a hold of a copy of the 9-line medevac form so that there's some information there.
Especially in things like ski patrol, when the National Guard search and rescue, you're assisting.
Absolutely, yeah, that is absolutely a situation where you would hear it. Salem National Guard unit runs all of the Blackhawks that do search and rescue extraction off of Mount Hood. So if you're doing anything involving ski patrol, that's a great form to have available to you.
And so you think that kind of communication kind of came about just for a rapid response, being codes instead of really having to talk about the entire situation of what's going on?
You want to hit that?
So what it does is, like he said, 3, 4, and 5, those are the lines you want to get out immediately, because those are the ones that are going to get a bird in the air. Because the biggest problem that they have on the battlefield is getting medevac there.
Right.
So that's what you want to get those out right away, and then you can follow up with the other ones. Does that make sense?
Yeah, the codes or the brevity codes that you're going to hear on there are for protecting transmissions as well.
Okay.
But
Kind of coding it up so nobody listening in can figure out what's going
It
on.
does, and it's also more easily understood. If you have broken communication, it's a lot easier to figure those out and be able to jot those down when you hear just a part of it.
You get a number instead of interrupted lines.
You get
Gotcha.
using alphabet or numeric.
It's like a whole second language that everybody knows, and it's way more concise.
absolutely,
I like that a lot.
absolutely. All right.
Yes. So in our side of things, generally when you're doing a handoff, it's the person who gave treatment is actually talking to the oncoming nurse or whoever, the greater amount of care that you're giving off to. Is that the same here for military side?
Oftentimes, that's actually not the case.
More often than not, it's not going to be the case.
Yeah.
Because a lot of times, especially if you want to focus on being an actual wartime casualty,
Let's focus more on civilian
Okay.
civilian side that you'll see in a training environment.
just based on whatever your duties are, you may not be able to do that handoff. You have to give them to somebody else and let them do that, because you have other responsibilities, greater responsibilities you need to do. So a lot of times it's a real quick, this is it, and then you move on.
Also, you may get a member of the soldier or the casualty's leadership within their unit that is going to do the handoff to you. And they're going to pass along information that the medic has given them, but they may not have medical training themselves, so they may not know the terminology or anything like that. I know civilian side, you never pass off a patient to to anybody lower level of training than yourself.
Right.
In a scenario where you're caring for multiple individuals, you may have to evac or send somebody to evac somebody less urgent to evac with somebody who is lower level than yourself.
Makes sense.
Yeah.
In talking about verbal handoffs and whatnot, what's the difference between, we give a HERE report as civilian EMS, but you guys give a MIST report, so can you expand on that?
Yeah, so the MIST report is focused a little bit more on trauma. It's because that's the main mechanism that we see. So it's an acronym that gives us kind of a format. The M is our mechanism of injury. Our I is the injury sustained. The S is the signs and symptoms, so usually that comes down to vitals, and also mentation. And then our T is any treatments that we've given. So if you hear one of those come across the radio, or if you have a medic who's in a hurry, he may just default back to that, or a military medical provider may default back to that. So just so you guys have an idea, if they start talking, my MIST report is as follows, that's kind of the information you're gonna get in that order.
Mm-hmm. Do they still speak that in code?
No, the MIST report is usually given just plain speak. It's usually 2 to 3 minutes before, let's say, a medevac comes to show up, so that the medics in the aircraft know what to expect.
Good.
Or the receiving facility knows what to expect as well. So that's in plain speak.
Mm-hmm.
Good.
Makes sense.
Who's trained at these levels that we're talking about here? You know, just from the guy who's out on the ground, or who you're transferring them to. What are the different kinds of levels of EMT or paramedic as we have it? What is that in the military?
Well, normally, as a medic, as a 6-day whiskey, you're an EMT. If you're gonna hand off to somebody else, it's gonna be the next echelon of care, and they're usually going to be paramedics, like on the medevacs,
Mhm.
and or to a Rule 2 or higher facility to get the extended care that they need. So, at the basic level, we're all EMTs, nationally registered in the military.
Also, you may run into what we call CLS, or combat lifesavers. Those are just our ground level troops who get once a year they get a 40-hour course from the medics on basic first aid. They have on them some medical equipment to be able to do interventions, but they don't have nearly as much training as, say, an EMT or a paramedic would. You also got, between branches, you've also got different levels of training as well. So the Army gets a 16-week expedited EMT program that they go through. I know the
Coast Guard was 6 months.
Coast Guard is 6 months. Navy is somewhere around there as well.
So that's pretty similar for us as well. That EMT basic at least is our 6-month cap, and paramedic further training. So
Yep.
Seems like more for you guys though, that's coming more specifically on the experience that you got just randomly, as opposed to like going to the hospital and taking on calls and stuff like that.
Right, and mostly what they're going to do, most of our training, EMT is actually a very small portion of our training. It's very, very condensed. And then you move on from there for the rest of the training.
Yeah, so pre-deployment training, if you have a medic who has never been deployed, they won't have gone through some of the more extensive pre-deployment training, also won't have the as much experience as, say, somebody who has deployed. Not to say they're a worse medic, they just won't have had as much experience.
They would just have the basic training that everybody gets.
Right.
Mm-hmm.
But it's just,
At least
like
everybody's
anything
got
else.
some kind of basic training.
Yeah, it's just like anything else. You get into that field,
Mhm.
and you get the experience, because now you're doing hands-on. So it's OJT.
Mm-hmm.
Cool.
I had one more question. I was gonna ask about the HIPAA. How is that different? Because you said something about in between the branches, there's different HIPAA certifications.
No, HIPAA is going to be the same across the board. The difference in the military is you'll have senior leadership,
Mhm.
but they are going to have to know more importantly, disposition
Mhm.
of the patient.
Mhm.
Just because that's what they have to know in order to pass it on up the chain of command.
Right.
So there's certain things that they do have to know, and most of the senior listed and officers are going to be HIPAA
Yeah, it's a requirement for all commanders in the National Guard as well as first sergeants to be HIPAA certified. So you can pass information along to them if that is necessary. They have a duty to contact the families of an injured soldier to keep them up to date. Obviously, there's a timeline for that. And they also, like he said, they need to be able to pass it up the chain. So again, you want to hold to with HIPAA the only pass on along that which is needed. But if you do pass on a little bit more information than maybe is necessary, be aware that they are HIPAA certified, so they understand the requirements inherent in patient confidentiality. And they are authorized to actually receive some of that information.
Makes sense.
Perfect.
Written communication was
The other one.
that we were hoping to go over. So we have some copies of these here, and we're going to go ahead and flash some onto the screen. And we've got, some of that information for you guys as well.
After looking at the charts that the military used, I noticed that there was no data section, whereas in the civilian charts we have a data section. Could you expand on that? And does it seem like there's less paperwork for the military than there is for the civilian side?
That's a really good question. This first form that we've got here is what's called the Form SF600. This is the military's standardized form for documenting medical care. As you can see, it's fairly free form, but medics are trained to adhere to SOAP format. So it should look fairly familiar when you take a look at it. Quick thing to note also is that left-hand column under the word date is generally utilized for vitals. So you'll see a list of different sections of vitals along with their time listed in there. And the bottom section is mainly used for demographic information. And it has kind of that open area used to identify the patient. Most importantly, down there in that bottom left is the patient's unit that they adhere to, making sure that the documentation gets back to the correct leadership so that his care can be properly continued by the medic after he leaves the medical treatment facility if necessary. The next form that we have that we're going to show is what's called the Tactical Combat Casualty Care Card. This is used for a rapid documentation of trauma treatment in the field. Each soldier carries one of these with them, and they'll pre-fill out their demographic information so that we don't waste time with that. So you'll see their name and their unit, and most of the time they will fill out their allergies as well, so you can look there for allergies if you can't find it elsewhere. Also, you'll see a quick diagram of the patient where medics are trained to use this diagram to indicate the placement of injuries as well as body surface area that's burned. You can see the rule of nines listed there. And also they will usually document treatments that they give. So if they place a tourniquet somewhere, you'll usually see it documented on this diagram. Underneath that is an area to document vitals. And this is actually a two-sided document. So the left column is the front, the right column is the back. And on the back of the card, you'll actually see pretty much every intervention that is within the Army medic's scope of practice, so that they can indicate anything that they've done with a simple circle. So you'll see anything from a needle chest decompression all the way down to administering hemostatic agents or the IV fluids that are given. It also has a place to document any medications and then quick notes that can be given. So that's generally how the U.S. military goes about documenting their casualties.
I know that for the civilian side, we use things like medical alert bracelets to identify people's pre-existing medical conditions or allergies or medications that they may be taking. I was wondering if the military did anything like that, and if so, could you explain that, please?
That's actually another great question. Up on the screen, we're going to go ahead and put an example of what's called a medical warning tag. All soldiers are required to wear a set of dog tags around their neck, and anyone who has a documented allergy or medical condition actually is required to wear one of these red medical warning tags. So if you happen to come upon a soldier or you're treating a soldier and he has one of these tags, it's a quick and easy reference for any issues that may come up. For your guys' reference, the first line is used to identify the individual. The second line identifies any drug or serum or other allergy. The third line is used to document specific conditions or potential problems that you may see, so something like diabetes. The fourth line is used for specific drugs that they are on so that you can avoid any kind of drug interactions that are undesired. And then the fifth line is used for any additional data or administrative entries, and it may be absent. This concludes our discussion of documentation in the military versus that in the EMS. I would like to give a special thanks to Staff Sergeant William Rudy for coming in and chatting with us, and hopefully you guys picked up some good information from this. Thank you guys very much.